pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, good morning, everyone. Thanks for coming today. Weather's finally nice. We'll get started with the consent agenda. Looks like we have a couple of
I'll move that for you.
pay things in the minutes. Got a motion, second, any discussion?
Yeah, just real quick. I thought, maybe I'm reading this wrong. Jen is not in here. But if I am reading this right, wow. Should have been ready for this. Sorry about that. I thought we only had like 8 steps. Is each department's different? Because this shows 15 steps in grade 8 on the one person, and then the other person was 15 steps grade 4. And then they have them at 12 and 5 currently, so I guess we can talk to Jen. I just was curious of
I'm
how.
not real sure. I think after, the meeting, I think he was just trying to adjust it to make it match what he thought it was supposed to be.
Okay.
Yeah, I'm sure.
Okay.
I'll check on that. Any other discussion? All in favor signify by saying aye.
Aye.
Aye. Motion carried. All right, next up, we got John Rasmussen, our county engineer. He's gonna be opening bids received for the Hancock Maintenance Facility. John, go ahead and take it away.
Good morning. We have 6 bids for the Hancock Maintenance Facility. Our estimate for the project was $2,147,870.
2,800,000?
$2,147,870.
870. Okay.
We'll start with the Anderson bids here. I'll check to make sure they're complete before I read them.
So did that number you just quoted, did that include the land and everything else too?
No,
then?
this is just the construction.
Just the construction.
Looks like there's a motion to open bids, or no?
Motion to open bids.
A motion,
Second, thank you.
motion second. All in favor signify by saying aye.
Aye.
Thank you.
If you read it out, I can write it down. They have the bid bond.
Where's the addendums at?
They just signify that they got them on the back page. Addendums 3. Yep.
They're addendums, bid bond. The first bid with Anderson Construction is $2,191,735.
So the bid bond, yes. Addendum, yes.
Yes, they received.
Is that right?
Yes.
Okay.
Performance labor and material bond is included in the base bid.
Okay.
So that'll be blank. It should be included on all of them.
Okay.
Too many papers.
Who's this one?
The next one is ATO Builders.
ATO?
Yes. Bid bond. So the bid bond's complete. They signified they had 3 addendums. Their bid amount was $2,599,000 even. Opening Construct Inc. Bid bond's complete. 3 addendums. Their bid amount was $2,316,000 even. Next bid is Dicon Inc. My letter opener's getting tired. Dicon included the bid bond. They have 3 addendums as well. Their bid amount was $2,419,000 even. Jensen Builders at Fort Dodge be open next. Envelopes inside of envelopes. Take that out. They have all 3 addendums?
They do.
Jensen, right?
Yes.
So Jensen has a complete bid bond. They signed off on all 3 addendums. Their bid amount was $2,148,000 even. My letter opener completely gave up. Should have tested it. It's been through too many lettings. Last one was United Contractors, or United Construction, sorry. They have a complete bid bond. They signed off on all 3 addendums. Their bid amount was $2,490,000 even. That was the 6 bids. The apparent low bidder would be Jensen out of Fort Dodge at $2,148,000.
Thank you, Kevin.
Where's United?
Atlantic.
Okay.
So you're gonna take those and review them, John, and then come
Yes.
back to us?
Bring those back for award.
Are they here today?
Most of them are here, yeah. Some of them are
Is
left.
it?
May I say something?
Go ahead.
I just want to thank all of you guys for bidding it. I appreciate all the hard work. I wish I would have said it before the other people left, but to have 6 bids is a really good indication of what we wanted to see. So thank you all very much.
Very close. Very, very close.
That's with constructing Shane Bassler.
Oh,
They did Veterans Building.
Okay, I'll make a motion to approve and authorize the chairman to sign a right-of-way contract with Chad Eitman and Chris Eitman Trust
Okay, the motion, is there a second?
Second.
Motion second, any discussion? All in favor signify by saying aye.
Aye.
Motion carried.
Chairman Tilton, I'll make a motion to approve and authorize the chairman to sign a right-of-way contract with Charles W. Johnson and Beth A. Johnson.
Second.
Got a motion second, any discussion? All in favor signify by saying aye.
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 Motion carried. Okay, Grant, you on the phone?
Yes, I am.
All right, Grant, we have you, Community and Economic Development Planner. Discussion decision on authorizing MAPPA to issue a notice of intent to award proposal for asbestos abatement work on the Carson and facade rehabilitation project.
Yeah, so after 2 previous attempts at procuring for this, both of which were unsuccessful, MAPPA subcontracted with an asbestos inspector back in July to write up some specifications and facilitate a contractor walkthrough. We received 3 proposals with the lowest price coming from McGill Asbestos Abatement. They're out of Omaha. Their price was $24,730. The inspector that we worked with did think that their cost was reasonable for the work that has to be done, and that work mostly involves removing sealant and caulking around doors and windows. That's the vast majority of the type of work that's going to take place. And their price was also within the grant budget, especially so now having received the bids for the construction piece of this. So this is just really a request to accept McGill's proposal and to allow us to move forward with drafting a contract for the work.
Okay. Is there a
I'll
motion?
make that motion.
Got a motion from Ms. Drake. Is there a second?
Second.
Got a motion and a second. All those in favor? Wait, discussion, sorry.
Hey, Grant, real quick,
Thank you.
is there any asbestos abatement needed to be done in Macedonia, or is this all in Carson?
This is in both towns. There are 7 buildings total that identified. I can't remember right offhand the number of buildings in Macedonia, but it was either 4 or 3. So and it's all exterior. So again, just mortar, some sealant around doors and windows, that kind of thing.
Okay. So, Ms. Drake, the on the printed agenda, it only mentions Carson, so if we amend your motion to include Carson and Macedonia?
Exactly.
Oh, okay. Yes.
All right, thank you.
Okay. Any other discussion? All in favor signify by saying aye.
Aye.
Aye. Motion carried. Grant, thank you.
Thank you. Thanks.
Next we have our county treasurer, Voss, discussion decision to approve payment of drainage taxes for county-owned properties. The amount looks like $1,112.
I'll move that.
Got a motion? Is there a second?
Second.
Got a bunch of
Got
seconds.
3 of them.
Pick whichever one you want.
Yeah.
Any
What's up?
discussion?
What's that look like from the number from last year? Is that about the same? No, those parcels appear to be all down in like west of 29 that we got after the 2011 flood, pretty much. Because John pays for all the roads and stuff like that.
I was gonna ask if you guys wanted to pay those.
You can ask. You can, pardon?
I could have slipped them in there, you know.
Yeah, you can ask. Okay.
Any other discussion? All in favor signify by saying aye.
Aye.
Motion carried.
Thanks, Lee.
Thank you.
Well,
It was a tough
Not
one.
done.
yeah, she's not done. Where is it?
It's not on here, but it was on the agenda.
Yeah, it was on the agenda.
Let's see.
Why wasn't it on there?
It is on the agenda, it's just not on the script.
Right.
It's all good. We'll get it fixed.
We
Yeah.
can roll with it.
So, looks like we have, so this will be to abate the taxes on the near to Medical Center property located at 510 North Elm Street. Parcel number 773909332009.
Every year.
Got a motion, is there a second?
Second.
Got a second, any discussion on this one? It's just one of those weird ones that we have to deal with. All in favor, signify by saying aye.
Aye.
Aye, motion carried. Okay, thanks. All right, next we have Matt Wyant, Director of Planning and Development, Nick Jedlicka, the Director of Veteran Affairs, and Garfield Coleman, Safety and Risk Manager. Update on COVID-19.
We wanted to come in today and just update the Board of Supervisors members on where we kind of currently stand with different activities that public health has been involved in with the assistance of Nick and Garfield's teams as well. So the update that I provided you, just some background information on it, was March 9th, Potawatomi County received notification of the first COVID-19 case. And 6 months from this notification is where we're at now. Our total cases have been at today, 1828. We've recovered 1,555 of those. We have 10 individuals in the hospital today. Unfortunately, lost 36 residents, and that leaves us at a current case count of active cases at 237. For our long-term care centers in Potawatomi County, we have had 3 outbreaks out of 15 care centers that have been impacted. When you look at the fatality rate, we've had 23 of those fatalities of the 36 have come from long-term care centers. All of our long-term care centers are now out of outbreak status, and they don't have any current cases there at them, but we are still following through with contacts with Risen Sun and Oakland Manor, and that'll continue on for a period of time.
He's telephone.
We just thought you needed a compliment. Yeah.
Little background.
Somebody's got us on hold.
Elevator.
Can I do it? Ramada Lounge.
Yeah, I'll hang up. Jenna was gonna dial in, but okay, we killed the phone.
They can call Melissa and she can transfer to this one.
I'll just have her come in.
Okay, so.
Going on with our schools, all of our school districts participated in a Wearing is Caring campaign. That was a campaign kind of driven by the PIO from the City of Council Bluffs, Ashley Cruz, and the Council of School Districts, where they went around and got all the superintendents and everybody wearing their face coverings and did a big media campaign to try to really help stop the stigma and to encourage use of face coverings for the children when they're going back to school. Each one of the school districts has been impacted by the virus, and they've implemented internal contact tracing methods. We did a big push with them on the before back to school, just kind of a building trust. How that was going to work out, and written guidance from us, so that way we made sure we really had a streamlined communication method with them. We wanted to stop as many slip-ups as we could before we even hit that part of it. So everything comes in writing from us, everything comes in writing from them, and then that way we have, and has to be changed by those people that initiated the writing. So unless the school issues us a change, nothing in our guidance changes with them. And it's been working fairly well at this part. We've had some challenging questions come up with everybody trying to test the systems, but it has worked for us so far. Out at Iowa Western Community College, our testing location has opened up for students and staff out there. On average, we test about 3 people a day. This is in conjunction with our Omaha Women's Fund grant on access granted. That's for easier access to sexual health care. The testing site out at Iowa Western is just for staff and students. It operates off of the Test Iowa platform. And then we've partnered with All Care so that the DOT doesn't have to make a number of stops. We take our samples down to All Care by 3:30 every day, and DOT comes, picks it up, and transports it for us. So that has been a successful operation so far.
currently down at our Joshua House. That was one of the initial sensitive populations that we kind of identified. We have 14 active cases down there. They were able to withhold the virus from the facility for this long. We really compliment them for that. Public Health's been partnering with All Care Community Health Center on treating the situation. We put it in line with our long-term care protocols. We've assembled the same spreadsheet, same kind of contact with them. We put them in touch with infection control right away to kind of go through their practices, making sure that they weren't cross-pollinating any staff. And we had shower trailers down there all summer long for the campers that camp out, and then they used to come into the shelter for showers. We had a shower trailer down there. They were able to keep that many more people out of the shelter. And today we're just putting them in touch with EMA, get them some more PPE down there, and hopefully contain that. 2 of those cases from there are hospitalized cases right now. For public health staff, our public health nursing staff has transitioned back into their pre-COVID roles, and that is for administering vaccination clinic, common immunizations, flu shots. Staff's been doing their training on the pilot program of Access Granted. That is new into our area this year. And we now have all new disease investigators that are continuing to contact tracing and communication with our active cases. Those disease investigators, we have everything from really experienced retired public health nursing all the way down to kind of your fresh out of school, but it's a really good group of individuals, and they've been doing a great job for us so far. And to speak on the vaccination planning that we have, I'm going to turn it over to Nick so he can explain to you a little bit about what they've been involved with on that side.
Yeah, so for over the last 4 weeks, we've been working as a group to develop it's the mass prophylaxis manual, so mass vaccination manuals, just so everybody understands what it is. So you kind of see it's pretty big, it's very detailed. There's 12 sections to it and 24 appendixes that all kind of feed into the sections on what we're doing. So basically what it is, it's a manual on how we're gonna operate this vaccination when we get it, right? So what we did, we kind of coordinated with a couple other counties. We interviewed we have one of the nurses that was here for H1N1. So we kind of talked to her and kind of put some of those lessons learned from that event into here, which is kind of important, and I'll get back to that. But we also used the, Cities Readiness Initiative group planning. So we kind of incorporated all these other areas into this plan to make our Potawatomi County plan. So now that we have this complete, this is still in draft form right now. It's actually at the Board of Health pending their approval at this point. So, I mean, it's past all of us. They have it right now for review. So hopefully it'll be approved here in the near future. So we're actually going ahead and we're starting our planning off of this already. So the next phase of this is we're going to start doing coordination meetings with the Unified Command like we had set up before. So that's Council Bluffs Police, Council Bluffs Fire, the EMA, and then the Public Health Division. So we have our first meeting on Thursday with that. So it's really just a coordination meeting to start setting up, our initial planning on what we're going to do with it. So, which will really feed all the appendixes that we have identified in this plan. So, also Pot County Sheriff's Office, I didn't want to leave them out. But so the goal of the coordination group is to ensure they have prompt vaccination, easy access, and orderly processes in a safe environment, leading to a satisfying experience for residents. So I was saying about the H1N1, apparently there was some confusion with that. There was some fights on the lines. The public wasn't very happy after that one. So we kind of we don't want that to happen after this event. So just kind of a timeline. So Iowa Department of Public Health has published to really start planning to start receiving vaccines by the end of October, early November. So it doesn't really leave us that much planning time to get there from where we're at. So are we going to get it at that time? Who knows? But that's what they published as a planning guideline. So they've also published a priority list with that. So like your medical staff, and then it goes into first responders, and they already had it kind of listed out on who's going to start receiving it as it comes in, which we will follow, the federal and state government guidance on that. So
I have a couple questions for you if you're ready for those.
yeah.
So as far as Just draw a blank what my main question was. This is a two-part vaccination.
As of right now, it is a 2-part vaccination.
So we'll do like, you get one and you come back so many days later and you get your second.
So what I've seen, it's either 21 or 28 days later, you can receive the second vaccination. And I also just read this morning, there may be some planning consideration. If you got the flu shot, you might have to wait 4 weeks in order to get your first shot. So there's gonna be a lot of work involved and time to figure this stuff out.
Okay.
So are you receiving the vaccinations?
We will once they're available.
The public health will,
Public health will, yes.
and for the whole county?
For the county, yes.
Well, they got parts of it that's gonna go through the IRS system, which certain institutions gonna receive some, and public health's gonna receive some as well.
Certain institutions?
So IRS is like where they tracks all the vaccines and the shots,
Right.
right? So like say Risen Sun, if they're signed up through IRS, public health can sign off on them getting the vaccine and those will get shipped right to them. They can take care of the
So
residents
do
and
we
staff.
know who's all in Pot County signed up with, what'd you say, Iris?
We do.
Okay,
The state published that list for us and gave us who's signed up currently.
is there quite a few then?
There is a number of them. I mean, it goes into pharmacies, all the healthcare providers that are signed up.
Okay, so will they let you know how much they receive and?
We have to approve their allotment. According to what the state's telling us right now is that we're going to have to approve their allotment. So
You, the public health?
if, say Jenny Edmondson sends in and they say, we want 10,000, order of it, then it's gonna come to we have to approve that and before they get it.
Okay.
So some other dumb questions here. I mean, is this something like, is it something we have to keep refrigerated? Do we have a receiving facility for this? Is that facility
Yeah,
secure?
that's really great questions, because yes, so that's what the coordination meeting is gonna start, so what they're saying right now is one of the shots you can just keep like in a normal freezer, but the other one has to be stored at -80 Celsius. So they already told us don't go out and buy, cold freezers like that, because they're like $25,000, $30,000 and you can't get one right now anyway, so. There's a place in Omaha that sells dry ice, so we gotta like figure out what that process is gonna be for storage on that, which we don't know what their guidance is on that yet, so.
Okay.
It goes into more too with the coordination, so the state will push out some supplies with it, like needles and alcohol pads and
But they're not sending us bandages and they're not sending us gloves.
no bandages, no gloves,
Sharps
no
containers.
sharps containers, no.
But is that all stuff that we can, get reimbursed for through the COVID money?
We will submit for reimbursement for what we purchased for this.
So this would be like something that, if you guys don't source it, this might be an opportunity for like, say, EMA to go, hey, we need 240,000 Band-Aids or whatever,
Correct.
that's okay.
Right, and that's what the meeting's gonna start on Thursday, is start getting that in motion.
I guess, so you'll just keep us up to date on this through your regular meetings that you do during the week? Is that kind of how you plan it?
Yeah, the more that unfolds on that, then as the elected briefings go on, we'll do our best to keep that current information out there.
And public health has the lead on this, correct?
Correct.
Okay.
So that would, and I know you're just starting to do it, so would you be looking at least a couple locations for public health to do this, or would it not?
So kind of what we're talking about right now is really, we're looking at the Mid-America Center, which we'll walk through, we're gonna do a walkthrough on that on Friday, but.
That's pretty much the western side of the county.
Right, so then we kind of talked, which we're still obviously in the beginning planning
Sure.
phases of it, we're really looking at Oakland, because then you can get
Right,
all of
yeah,
that,
get
that side of the
quite a bit, yeah.
county, going, so they don't have as far to travel. We are looking at a second option, but then, once you really start breaking down all the positions that you have to do this,
Yeah,
and it's just a lot of planning and coordination.
And then those other locations that's within Iris, so those
Right.
western side will be able to go to those facilities as well.
well,
So,
assuming do those facilities have to accept?
No,
no, they don't have to.
See, that's the issue if they're, and then would it just be a Monday through Friday type thing, you think?
well, it's gonna have to be easiest access for the people. We've had a lot of discussion about that. It's not, we don't foresee this being an 8 to 4:30 piece, I mean, we're gonna have to catch a lot of people in the evenings, we're gonna have to catch a lot of people on the weekends.
Yeah.
In order to do that, one part that we've, really thrown around is, being able to hopefully draw in staff from other departments in the county to help us out with the administrative side of this. The administrative side of it's gonna be pretty heavy, and, do we look at this as a county and say, well, yeah, we could potentially pull some people from conservation that do a lot of administrative work? The treasurer's office does a lot of detail administrative work, and have those employees helping us on those things rather than trying to hire out temps and risk human, a lot more human error than what needs to happen. And so those are be kind of some of the things that we go and not only talk to you about, but talk to department heads and kind of gauge the interests of their employees and being able to help us in that, because you really have to do at the triage desk area, or registration desk, what we call it. I mean, there's a lot of information that's gonna get gathered there, and then back to where you get your shot, and then there's you don't just walk out. It's not something that you can just drive, pull up in a car, get a shot, and drive away with. You're gonna have to, you come in, you get triaged, you go get your shot, you come in, then it's a recovery area that you're gonna have to be in for 10 to 15 minutes, and what are all those different elements of how traffic flows through there.
Okay.
And socially distanced through the whole
So
process.
once you've had your coordination meetings, you'll come back, kind of tell us the plan.
We'll develop some COAs, courses of action to present, yes.
Are there any lessons learned from, I guess, the Test Iowa system that we can implement to coordinate some of the
So yes,
flow?
so some of the things we've been thinking about is how we're gonna streamline this and make it faster, because, you get the shot, that has to get uploaded, there's the registration. Can we do this online, just like Test Iowa? So Maria kind of already started with that. We're trying to find a program that's, to even when we receive the vaccine, we just get a barcode reader and bloop, it goes into our inventory. You walk up with your phone, you get your QR code, bloop, we validate it. So we're gonna try to make this, so basically kind of trying to model it off of the Test Iowa is kind of what we're thinking, But Maria's already had a meeting with them. What was that company? I put you on the spot, I'm
You
sorry.
did, you totally put me on the spot.
The one out of Utah that's running it?
No, it wasn't Domo. This one was Business Source, or it had a name to it like that. And they are going to be in charge of the CDC's VAM system. That's a Vaccine Administration Management System. So they're going to be the ones at a federal level tracking all of this. So when they reach out to us, because if we can start at our level tracking right into the VAM system, because you have VAMs for the federal level, IRIS at a state level. And so how do we make all three of these systems coordinate and track together is what we're looking
Will this
at.
software allow us to, because we talked about this before, I know you guys are gonna troubleshoot all these things, but I'm just gonna throw it out there. Someone from Nebraska says, oh, well, I was doing this, vaccinations. Is there a way to stop that? Or does it matter?
There's never gonna be 100% way to stop that. But that's exactly what happened during H1N1. And those coordination meetings will also happen not only here locally with our unified command, but it'll also happen across the river with our other health departments. And the one thing that we will do this time that did not happen last time is we will stick to that coordination plan. When the original coordination plans, from lessons learned at H1N1, what happened was the counties, Potawatomi County, Douglas County, Sarpy, and Cass all got together and said, we're gonna open up shot clinics on this date, and these are the priority people who are gonna get those vaccines first. And everybody at the table said, okay, that sounds good. Everybody went back to their counties, and then when Potawatomi County got over here, they kind of kicked open the doors and said, hey, we're gonna give shots to everybody. So there was a huge influx of Nebraska residents that came over here, and that's where you got the really long wait lines, 3 to 4 hours standing in line, people becoming very frustrated. And
Hopefully
so
these QR codes should eliminate, because I'm assuming you have to register somehow, right? You go online, fill out the thing, gives you your general time to come down, get your shot. I'm hoping that'll alleviate some of that, but I do worry about that. But yeah, if you guys are coordinating with Douglas County and.
Salesforce.
I suppose the smaller counties around us too are gonna be Mills and Harrison. Not to say that we're not gonna support them, but however, we just need to make sure it's spelled out so they understand. And then we need to make sure our communication on that's the biggest thing, is just how are we gonna communicate this plan to everyone? Are we just gonna rely on non-parental? We're gonna push this in press releases? How do you wanna do that? And you don't have the answer now, I'm just saying, think about it.
We have a section on that.
Could be easy, could be a cluster, so good luck.
So will and I think now the schools require a vaccination of the kids to go, before they can go to school, or is that not accurate?
They do, there are certain vaccinations that are required for children to attend school.
You think
Chickenpox is one of them.
Right, you think this will be,
They've made no indication of that as of right now.
okay.
So we don't know if this is like a strain or a once in a lifetime thing, or we know.
They have not made any indications on that as well.
So just one other quick question on this topic, I guess. So anybody, I assume under the age of 18 would have to have somebody with them?
We actually, in the plan, there's a whole section on how to deal with unaccompanied minors and what to do to gain permissions.
Okay. Man, it's a lot of work.
Well, just keep us abreast of everything that's going on, and then in the back of your minds, be thinking about what this is gonna cost to us, at least maybe it's a refundable thing, but still, if we need to use some of our money initially to get it going, we need to know what that is, so we don't,
And
things are tight right now, so we don't wanna.
that's kind of where we're jumping to next on the update piece of it is we submitted for our CARES, our first submitting for CARES went in yesterday. And we submitted for $673,000 out of our allotted, around 1.2 million in funding. We are working with the departments and community partners right now on the remaining funds to see what's gonna best help prepare us for future events. A second submittal to this is due by October 13th. So we are lining up different things within the county, like water fountains with water bottle fillers instead. BPS units on the buildings to help scrub the air, the bipolar ionization things to do that. And the misters that we got, the electrostatic cleanings that we have. But we have an opportunity right now, really, I think, with what's residual of our funding that we have left there, because we are struggling to kind of hit those parts, is that if we're able to reach out to some community partners, thinking of what we're going through right now with the homeless shelters, to be able to say that we can do those BPS units on your facilities there to help out and prepare for future events like this, is one thing that we are able to do as long as it comes to the county. So they would get it, have it installed on their building, they'd send us an invoice for it, we would be able to pay that invoice and submit that into our CARES funding and get reimbursed for that. And those are some of the things that I think that we should look at doing as we move forward on this. Our FEMA funding, all of the county expenses have been handed over to Whit O'Brien. Whit O'Brien is working on forecasting those expenses all the way through the end of the year for us. And they'll be handling the submittal to the state on that. The very last thing we have for you is, and I don't know if you're available to pull it up on the screen or not, but as on the county website now, and that is for regular Potawatomi County website, you will find Mint Chip Labs built us a COVID dashboard. Has been added to the website. That dashboard gives you a zip code data per week since the onset of COVID in Potawatomi County. We're constantly trying to come up with new ways to inform the public and be transparent, and this is one of them that we really feel like is a benefit to everybody, because everybody's really looking for those zip code data points. And
What's the webpage?
Potawatomi County, potcounty-ia.gov. And if you go into the search bar and you put COVID, and the COVID dashboard will come up. And it's for every zip code in Potawatomi County, so it shows you all of the different communities. Honey Creek, Underwood, Carson, all of them are in there.
Is it, that 673K that we've allotted for, is there like a one-page sheet that just shows kind of where those categories and where that amount?
The majority of that, over $500,000 of that, came from public safety payroll.
Okay.
And then you have public health payroll, and there's really only $50,000 in actual expenses that we were able to bill for this time.
When you say actual expenses, like buying something physical?
That would be like paying for the sanitation crew that's been cleaning the
Oh, okay.
buildings. That was 30,000 of it. The paying for the.
We were only able to get 30 out of the for that?
Just this initial billing, because there's that cutoff date on it, so we can only bill up to so many, we can only put so many billings in. This next date, on October 13th, we will enter in the rest of the billings in there.
What do we have them through? Cleaning crew?
I don't know if there's an end date on it.
Oh,
I thought we went
we
to the end of the
agreed
year.
on
right?
it, yeah,
Then we gotta look
through
at it.
December.
Oh,
What
we
was
did?
decided in board meeting a couple months ago.
Okay,
To the end of December.
which is a total, what was it, 10 grand a month?
Just under.
Yeah,
Yeah.
98.72.
So can we submit that before it's expanded or not?
Not for CARES, it has to be expended for CARES.
So we'll be able to submit some of it before the October date,
Correct.
but after
Yeah,
that,
we'll get 2 more billings in there.
but we won't be able to after that.
Unless they extend the
Yeah,
care.
unless they extend, which we're expecting some sort of extension.
Oh, really?
Well, we have till December, there's no reason to cut us off in October.
No, I understand.
Yeah, so this is a new COVID dashboard at the top where it says show dates. You can go from the history, the onset, all of it, last 4 weeks, last 8 weeks of it. The top one just gives you overall picture of Potawatomi County and reported cases. You get the timelines down across the bottom for each week. It gives you a lot clearer picture of how it all unfolded.
So this is public, right? Or is
This is public. This is open. It's on the website now.
Then you break it down by,
Each zip code, even so, it says Avoca. That does not just mean the town of Avoca. It includes everything within 51521. So the rural portion of that as well.
gotcha.
And you'll see, of course, in a lot of these, the more rural zip codes that you don't get much of a giant rise in them. But we wanted to keep the data consistent on the side up to 140 because most people aren't looking at that as they're scrolling down. They just scroll down to see how far the bar jumps. And originally they had it kind of adjusted to where these were really making some jumps, but I think this gives a lot clearer picture of it.
So the CARES money went actually to the state, right?
In Oakland, you'll see a bit bigger jump. That was when, of course, the outbreak happened at the care center.
Oakland Manor.
Yes.
But the state told us what we were gonna receive for CARES money.
Correct. They gave us an allotted amount that we can apply
And
for.
we submitted back to the state.
Yes.
So the state doesn't have the ability to extend it? They have to wait for the feds to say?
The state has the ability to extend it to December.
Oh, they do?
Yes.
Okay.
They don't have the ability to extend anything past December because the feds haven't extended anything past December.
Okay.
Oh, I see what you're saying, yeah.
So why didn't they go to December?
51513
And,
Council's total.
I mean, Suzanne's got a pretty good chunk of change she's gotta try to.
Correct. She got 1.8 million that she has to try. They just gave
What theirs is for
they just
the-
pushed out the 1.8 million to them. We have to apply for ours and show expenditures to go with it.
She doesn't have to do that?
She will at the end, but they gave hers up front. They gave her hers up front. We have to apply for ours and
Okay,
submit supporting
okay.
documentation.
But hers is for the region, right?
Correct.
Yeah.
The last 8 weeks. Whole county.
What was the difference between 51501 and 51503?
That's it right there. So your 51501 is in the red, 51503 is in the blue.
Oh, okay.
And then the black line at the top is total cases for, combine them both.
Huh.
Pretty good, Matt.
Hospitalizations.
Midship Labs, we don't, no. Midship Labs reached out to us, I just thought of it this morning, you know, and offered us this. They built this for a few other counties, and I think it's gonna offer a good picture to the residents.
Yeah.
Nobody will ever be 100% happy with it, but
This is wonderful.
Cool, well, thank you for showing us that.
So Matt and Nick and Garfield, when you guys get your actual plan put together, you'll come back to us and let us know what that is. I appreciate that very much. Thanks for your work. Matt, one real quick question. You said that We submitted for $673,000.
Just over, yeah.
Do we get 75% of what we submitted?
No, this is CARES dollars, so we would get all of that $673,000. FEMA is the part where there's a 75%, but the state has held back a portion of funding to pay for the 25%. So the state put 125 million together to dole out to the counties and cities. And then they withheld 25 million of that to cover the 25% that we're not gonna get from FEMA. Current understandings.
Thank you for the
Realistically, we could be fully funded for all of our expenses.
Our goal is to be, yes.
You have to get it first.
Well, it's there, and we submitted it on time and all
Right.
that stuff, right? So
Skylar Dooley did all of the initial push for this CARES funding. He really, worked hard to gather all the data that was needed and all the supporting documentations that was needed for it. I reached out at the end of this to Melvin, Becky, and Jenna, just on the Tyler side of it. I really feel like that, with the number of reports that they're asking for payroll wise and what they need on it, that the Tyler system would have some pre-built FEMA, this is what it takes to get a FEMA report. It's got your person's name, title, their pay rate, what hours they worked, when, whatever. And we're able to just click that thing in the future. And it sounds like we may have to potentially pay Tyler to build something like this. And it would be a huge benefit to the county to be able to have a FEMA report built and ready to go in Tyler. So that way we don't have to try to search around for reports that meets maybe what FEMA wants and what they don't want. If we just have that one report that we can just click on and it pulls all of our payroll information. And I think we're getting some good lessons out of this.
An update on that, Matt, is I pushed back after she gave us a quote on a price and just said, we can't be the only county that's needing that. So she's going back to the analyst with that question, so.
So, besides the Board of Health, Nick, when you get this plan put together, is there anybody else that has to, I guess, bless it or anything besides that? Is the state or?
So this goes on file with the state
Okay.
and the CRI group, the CRI, what's that?
City of Running National.
No, but what's the other group besides them, the 13 county area? SWIP, and then, so you have this people from the Iowa Department of Public Health for your preparedness. They will want a record of it.
Okay.
Not that they'll approve it or bless it, but they will give you pointers.
Right. But we're not probably gonna get the support we got for the Test Iowa for this with, whatever, the National Guard or state troopers or DOT or anybody like
They haven't
that.
said anything about that.
Right, so this is gonna be
Not that
our,
we couldn't request it though.
right,
Maybe
well,
with it.
we can request it to the governor, you mean?
Correct.
Okay. But it sounds like we're gonna be on our own, I'm guessing. So will you be able to come from other counties to our county, or is it gonna be done by zip codes, do you think?
Well, you're getting an allotment based on per capita of your county.
Okay,
So I imagine you're gonna have to go with that from inter-county.
okay. Thank you very much.
On the planning side of this and what we've done so far, I do want to thank the board of supervisors for allowing, Nick to be a part of this, Garfield and Jake to be a part of this to really help public health out. I don't know that we would be where we're at without being able to have this leadership team assembled to make it through these decisions, because it would be too much for me to just sit there and try to handle all this on my own.
It's huge.
Yeah. Who would have ever guessed?
Well, appreciate the update, guys. Thank you.
Thank you for the report.
Chairman, Joe, can I make a motion?
Sorry, last question. Is there some way to make this available? Do you guys have this up on your public health Facebook or something?
What's that you're
This
asking?
update sheet you just gave us. I know you got the webpage, but is this document available?
It's nothing.
If I were to go on Facebook Live, like the minute of May or something, and read this off, that's okay. I guess is my point.
It is. I mean, it becomes a public document once it goes to the board of supervisors.
Yeah. I mean, probably do something like that just to get the information out.
Mhm.
Okay. Do you have a motion for something?
Yeah, I wanna, make a motion to approve the final plat of Hadley Acres and authorize the board to sign planning and zoning resolution number 2020-13.
Second.
Motion and second, any discussion? Is this what I need to sign for that? No discussion? All those in favor signify by saying aye.
Roll call.
All right, roll call.
Roll
Go
call.
ahead.
Supervisors Drake. Aye. Roby.
Good.
Wickman.
Aye.
Belt.
Aye.
Chairman Schultz.
Aye.
Thank you.
Sign this quick and then- Okay.
We get some discussion.
All right, moving on. Thank you for that. So next we have the designation of Pam Calstrip as the authorized representative for the, I'm not sure what that acronym stands for. Let's see, Homeland Security and Emergency Management. What's the D on that? Application. And to resign resolution, and to sign resolution 83-2020 entitled Local Match for Hazard Mitigation Grant Program.
So moved.
The motion, is there a second? Second. Okay, got a second, discussion?
Well, the only discussion is there, been any change, I guess, in the individuals that are in we got them already designated, nobody's adding in, right?
There's 8, and Terry Brown may be online too.
He's hung up on online.
Well, he might have been the music man, he's out now, I think.
So anyway, 8 homes.
That we're gonna be able to, we've identified that are closest to the priorities that we set up, is that what,
Yes.
do we have?
Can you get the list?
What did,
Pam's really she has really taken lead on this. So,
right,
she's got all that information.
so what did that
for you.
number, did that 8 pretty much gobble up our money that what was it, 1 point?
2.
Did it gobble it all?
2.2.
2.2, did it gobble it all up, the 8?
Can you send us the property list I think you had a spreadsheet before, if you just send us one that's highlighted with the ones that we paid out, that would help.
So those 8 are starting down the process then, or?
Well, this, Justin's going to sign a
Right.
document today to tell Terry Brown to move forward with the application. And
Are 2 of those 8, I think there's 2 there, those ones right on the, what do you call that, River's Edge Road, or what's that road?
River Road North.
River Road,
River Road North, 2 of them,
yes.
those 2, those 2 are 2 of the 8.
But we're still in the application process with the state, so we got those things identified, documents getting
So
signed.
it was already on that sheet?
Yeah.
Okay.
So,
There was no change from that sheet then of what 8 that you identified based on that money? Okay.
so the only thing left on that road will be that salvage guy then?
On that portion of the road, yes.
Yeah.
Which isn't remount closed, is it closed down or is it still operating? I thought they were closed down.
I mean, it's hard to tell with that thing.
Somebody bought it. Pam, local match for that? Where's the local match coming from?
Well, that's what the resolution that you guys are signing, that you
So
will
if we
pay
sign,
for the, that you'll commit to the local match, but we're hoping to get the,
CBDG
Yes.
money.
those funds.
Hopefully,
We're still on their radar to get those funds.
get those funds, or there's potential for, what they call it, FDF, flood funds that, flood board. Because
they get a few $1 million every year.
well, they're gonna get, almost, I wanna say 3 or 4 million back from, Honey Creek and Pigeon Creek because they got approved for, FEMA funds. And then, so that
We
money,
reallocate those then.
exactly.
2011, we got CDBG, right? Or CBDG?
Yes.
Yeah.
We don't ever get HUD funds, do we? See, the city got a bunch more HUD funds money again.
so Pam, I've got it up here now, and what it says that the Potawatomi County agrees to provide and make available up to $329,000, almost $330,000 for our match requirement. When FEMA helped out the counties south of us, they paid the match portion for those counties. Well, pardon me?
State covered it.
Will the state cover this?
That's what we're hoping for, but we have not had a solid answer on it.
And my understanding is they're finalizing the funding in Mills, Pacific Junction, and Fremont, and that will free up funds to become available to us.
Is this resolution time sensitive?
Yes, because it goes along with the application.
Yeah.
By approving this resolution, we are guaranteeing that we're gonna come up with that kind of, those dollars.
I mean, basically, if the state comes back and says no, then we're on the hook for the 300 and whatever is left. Right?
That's correct.
Yeah.
Is that our figure? And then the state has their figure?
No, this is the state number, this is the state figures. This
Right,
is for
but
the allotment that we have right
This
now.
is our portion.
This is our portion of it.
And then the
Yeah.
state has their portion.
So what's transitioning, and Terry's probably not here to tell you, what's happening currently right now is the state has found, they got the big award of CDBG money for, the state of Iowa got $96 million. We're close to that. Well, I think it was 75% of that money all went to Mills and Fremont, counties south of us to pay the 100% and help with their housing down there after the 2019 flood. So that instead of utilizing 75% of FEMA dollars on those buyouts, they're utilizing 50% of CDBG money to pay for that, to help free up more money to make available to other areas like us. But with the math that they're doing and the way that this application process works, we don't have a whole lot of control or answers on it. The state calls down, asks Pam, hey, can you submit this to us, can you submit that to us? And they move our application along. That application doesn't just go for one pot of funds. They use it for that FEMA app, gets utilized for the same time, crosses over to the CDBG side of the Iowa Economic Development Authority, who's in control of those funds, not Iowa Homeland Security. So we don't know how much money Iowa Economic Development Authority is gonna give Iowa Homeland Security to help cover our costs on it. It's a giant chessboard of shifting pieces around. And I don't even know that Mills and Fremont County have solid answers on where they are at. They were told that they were gonna be made 100% whole, but is that actually gonna happen? We don't know. Because The first houses in Mills County are just getting purchased now. Those close dates are just happening.
We gotta just figure out, I mean, I hope that we get reimbursed, you know, and if we don't, we gotta kind of figure that out, right? So is that, my question comes to my head, what about your impact fund? Can that be used for this? I know you don't want to, I'm just asking if it could be.
It could be, but I think,
Does it put some pressure back on you?
I mean, it's gonna, I think we're gonna be pretty much emptied out because we utilized it for,
You are,
the road and then the Carson Macedonia projects.
That fund's gonna be depleted?
Mhm.
pretty
We'll
well.
get reimbursed over a period of time, but, we use that impact fund to do an internal loan to cover the cost for the
So what,
road
well,
improvement.
that's fine. I mean, what money are we gonna earmark for this then, in the meantime? You know, we got, what money are we gonna say, this is the dollars, what account's it gonna be in?
Well, you're gonna get $673,000 back in CARES funding. $600,000 of that is budgeted payroll expenses. So that frees up $600,000 in payroll expenses that you would have had.
For the property acquisition, land improvement, that fund, Fund 19.
I mean, obviously the hope is that we don't have to spend any of this money, but I mean, we need to be prepared to if we don't.
Does the land fund have $1 million?
There's some, there'll be some gaming funds, you know, I mean,
We've got it assigned though, yeah, so it just depends.
I mean, it's a one-time,
No, I get it.
Yeah.
At the end of the day, this has, I shouldn't say it has to, but it should happen, right? I mean, I'm not gonna be the county supervisor to go up there and tell those people, hey, sorry, we're not gonna buy your property out because we're fighting about what account it goes in. So, I mean,
well, you know, the better we get them out of harm's way, the better we're all gonna, you know.
I just think that that'd be my recommendation to the board, that we put it there for now.
Worst case scenario.
Pam, the 2.2 million for the FEMA funding for the grant program, did that number come from the assessed value of those properties? Is that where that number came from?
No, it came from the appraisals that we had done, and then the demolition cost of 15,000 per property and 2,000 for the closing costs, so,
Have any of these people been notified?
yes,
And they're aware of the appraisal,
yes,
and everyone accepted it?
yes.
They have the option of backing out at the last second of this
They
deal.
do. But up to this point, when we decided how to prioritize, I contacted everyone on the list. And there were maybe 3 that said, no, we don't want to proceed. So everyone on the list was notified, the top 8 were again notified. And so far, they all said they want to proceed. But they do have the option of backing out the day of closing if they choose to.
Okay, what's the pleasure of the board?
Well,
Roll call.
I just don't think it's fair that if the state's gonna, or somebody's gonna pick up the county share south of us, that they certainly wouldn't pick it up for Pottawatomie County.
Well, then we need to get on our legislators and make that statement known.
We can't let up on the Iowa Flood Board. We have to still, we need to be up there. If the Flood Board is gonna have meetings, we need to have representation from our elected officials on those Flood Board meetings. Because those Flood Board meetings were going on for a long time that we had no knowledge of. And there was a lot of the eastern side of the state got a lot of funding out of that we were left out of it just because we didn't know that they were even happening. And we need to make sure that we stay actively involved with the Iowa Flood
I
Board.
sat on a bunch of those finance committee ones and they were just, there was no information. It was always like, well, we're waiting to hear from the state. Well, we're waiting to hear from the state, you know, and it was just, there never was anything that was relevant on them, you know, but then that's not the same though. That was on a committee. I wasn't on the actual flood board meetings, which I think John's, Representative Jacobson is on that.
and
I'll
David
call
Seek.
So we need to hit those guys up and
Are you made aware when those meetings are, Matt?
No,
They don't meet very, very often. I mean,
are we gonna have a lobbyist again? We should make sure, and that'd be something we wanna make sure that we have a lobbyist.
my understanding is that that's not gonna happen anymore unless we decide to do it, but, I had a meeting with the new chamber CEO and he indicated that that's not something they're pursuing again. So, which,
I would-
that's not his
hopefully-
call, but I mean, it was just, they're not gonna be in on it anyway, so.
Hopefully they would reconsider that, cause I felt like we benefited greatly from that.
Yeah, we can talk more about that offline, but I don't know, so do you wanna, I'll call for the vote?
yeah, I'm gonna, call today and see if I get a hold of Lucas and, Jamie with ISAC and tell them that we wanna be notified when there's a flood, do they call it the flood fund board, or what do they call that?
It's the Iowa Flood Board.
Iowa Flood Board, whenever they meet, that we wanna be notified, so see how that happens, and see what the process is for that. But I don't think they've met since the last time we were up there.
Oh, yeah.
I don't think so. Cause they don't have any money.
Roll call.
Yeah, let's go ahead and roll call, please.
Supervisors Groby,
Yes.
Wickman,
Reluctantly.
Drake,
Yes.
Belt.
Aye.
Chairman Schultz.
I guess I'd ask for the friendly amendment that we just, gaming, everyone's okay with gaming as far as the,
Well,
pot of funds, or do we need to research that?
Yeah,
Maybe it doesn't really matter.
This, we may not see this until 2022. These guys, this thing
It's
doesn't.
gotta still go through
You
the
need the money
application
back from the
process.
state.
Well, just the whole process. What's that?
I mean, I'm not expecting any, I mean, we're 6 months out, 8 months away.
Are we even doing this?
Yes.
Okay. Well, that's good, just have it
And
figured
then
out.
it was like molasses.
No, I get it.
all right, well,
I
thank
think it
you.
was
Pam,
18
you send
months
me,
that it took, the last one.
the state guy's contact information. What's his name?
Terry Brown.
Yeah, Terry
Hey,
Brown.
Matt, so, and I should have known, but that number for your, Monday, Friday is the same number all the time? The, ID number?
No, thank you.
Okay.
My own.
So,
Nice picture.
so you just gotta use the same number.
You did a good job.
There's a new, you got the new invitation?
For
The
this.
calendar invite? Yes, for Friday.
I don't, I'll have to look, but.
Let me know if you.
No, but if it's the same number.
Okay.
Okay, thanks.
Yeah, it's a little scary because, you know, it's not, it's a chunk of money, so.
Well, we had to do, I don't know what, we'd have to go back and pull up 11 and what we spent, and we took 20, I wanna say 28 houses after 11. And took the campground up there that at Honey Creek that the conservation's got now. Yeah.
So Melvin's not here, so it looks like Gina, payroll specialist auditor's office, discussion decision on the county opting out of the presidential payroll deferral plan for a period of 1 September through 31 December 2020. And approval of memorandum of county employees on the decision to opt out of said plan.
I would make that motion.
Okay, got a motion, is there a second?
I'll second it for discussion.
Second for discussion. Discussion.
Why are, I guess, are we required to vote on this?
You know, that was a question that we had brought up with Leanne. And,
I didn't see anywhere it just said that we had to do anything.
No, I
You
didn't
either
either.
sign up or you don't, you know, I mean.
well, it's not mandatory that the employer does it. So, and like I had come about and was talking to Melvin, is that I've got a lot of employees that have asked about it, wanted to know what it is. You know, so that's why we did this. If you're just gonna say that it's okay that I share this memo with the employees, that you agree that at this time, we as a county are not going to defer these
So, I don't
employees'
feel-
taxes.
I don't feel comfortable doing that, because the way I read that executive order and everything came out was that this is on the individual to make that decision. Now, we can opt in, as a county, we can opt into that, just like the military did. Department of Defense said, nope, everyone's gonna do it, and that's just the way it is, but I think as individuals, we have the choice. Like, if I come to you and say I wanna do it, by the way I understand the law, you have to.
Because everything, and I had Leanne even look over this too, and it is, from what, the understanding that we're getting is that this is totally an employer thing. If the employer wants to do it, then you have to do it and offer it to all of them. But you do have that option as an employer to opt out of it. And I mean, I can get you guys that.
I'm not, trying to argue with you,
Sure.
but I don't believe that to be true at all.
Okay.
So,
No, I can get all.
I think employees can go in and say they wanna do it, we have to do it. So I'm not gonna vote on that, I don't feel comfortable voting on this one.
Okay, that's fine, I can get that memorandum from that President Trump signed in.
The,
The whole point is to stimulate the economy, and if people want to do it, they can. I mean, I'm not saying, I wouldn't do it anyway, let's just be honest, I'm not gonna do it because I would rather my paychecks to stay the way they are, but some folks might wanna do that. But they gotta realize, come, January 1st through whatever, April, it's gonna come out. But
12.4%.
what's weird is you can do it right now, like I can go to you right now and submit a new W-4 and say, don't take any of my taxes out.
Okay,
Cause
this is
I gotta settle up with the IRS anyway, doesn't matter.
This is your social security. This is not your federal or your state. It's only social security. Everybody pays social security.
Yeah.
And that's what puts you in your social security bracket is your wages. That determines, so, yeah, there is no opting out of the social security, only if you hit certain ages and things like that.
we need,
want
I
more
think,
clarification on it.
I would too, and I'd like to see a legal opinion from either Matt or.
I haven't looked at it, I'm just looking online right now. Missouri, Indiana, Arizona, all as a whole state opted out for their states. So they're not gonna participate. So, I mean, it sort of leads me to believe if you've got states saying that they're not gonna participate, then obviously they're not saying the whole state. They're saying for state employees. So as the employer, the states have opted out. So, I mean, I'm not saying I've read it, I'm just giving you the,
Auditor's
but
base.
certainly, I would certainly hazard a pretty good hypothesis that if 3 entire states at least have opted out of doing that, then the employers obviously do have the right to opt out. But I'll have to look at it myself.
Auditor's base camp, I've been following the discussions on there in their counties opting out as a county.
And this letter has gone to Leanne, just to let you know, in the county attorney's office, and helped and went over to make sure that what was being stated is, true, and she did take some out and put some in, just to let you know that.
Mr.
gone in
Wilbur,
front of her.
have you?
I wanna go through it, so.
Yeah, Mr. Wilbur, have you read the actual?
I haven't looked at anything on it, other
Okay.
than what I've seen on the news.
The
Well,
only
I got
county-
the impression from some of those financial people that talk on whatever station and radio over the weekends and stuff, that the employers were the ones that drove the bus, but, that's just.
Cause you would have to even go as far as into getting Tyler, our software system, to reconfigure it to where not only does it stop you from having social security, but it also monitors it so that we know come January what we've gotta do to get those funds back, those taxes back. So I mean, it would take a program in which I have heard through Tyler Community, it is gonna be an update that will be available I believe it's tomorrow.
I honestly, just me, I feel more comfortable if we review this, I'll table it for another week. I would just prefer we know 100% for a fact. Leanne's not here, she gave you a piece of paper, told you to come, you know, I know that we can hedge our bet, but I'd rather just wait a week to make this call. It's not like we have to make it by tomorrow, it's not like that, so.
It won't happen tomorrow or
I'd
this
say
week.
we,
That'll give me time to take a look at it. I mean, I can see here also the, reports that the feds did not offer, I mean, since it's a federal executive order, right, the federal government said that you don't get to opt out if you're a federal employee. That's why the military has no choice. That's why all the federal employees have no choice. But it's looking right now like the feds are probably the only ones that can mandate it. But
yeah,
take a look at it.
let's get clarification on it, and we'll come back and visit this in a week from now, if everyone's okay with that. That's my suggestion, so.
I'm okay with that, Marilyn, are you?
Well, I'm ready to vote, but since
I'd rather
I can
put it
see
on-
that I
I'd
don't
rather
have
put
any
it
other
on-
votes, yes, I will
Well,
wait.
here's my thing is,
I'd rather postpone it until January.
I'll send it to you in an email.
well,
You know,
I would just
I
like to have a
brought this
written
up,
legal opinion, I mean,
a few weeks ago, you remember?
Yes,
talking about
yes,
that?
right, yeah, we've been tossing it back and forth.
But doesn't that amount to, will be, if they want to, we have to give them the money, at the end of the year, we get it back?
well,
That's kind of a pain.
so the way it works is that you defer your taxes, so you get paid that tax now. So rather than it coming out of your check, and then come January, from January 1st through March 31st, I think it's March 31st, they would start drawing it back out. Maybe it's April, I might be wrong on the date, but they'll start drawing it double. So, to the average person, probably doesn't matter, but if you're not someone who's conscious of your budget, it could really hurt our employees. And there's a purpose for it, and, whether or not it's necessary, I don't know, but I just feel a heck of a lot more comfortable if we know for a fact we have that right to do that. Because if we're wrong, and an employee comes here and says, I wanna do it, and we don't allow it, and sues
Get
us.
the program ready, is that correct?
They should have it ready by
Correct,
tomorrow.
but they'll have it ready they will have it.
Oh,
tomorrow.
thank you, okay, thank you.
It's not there yet.
Yeah.
But it's only the social security, it's not your federal, it's not your state.
So which way is
and
she
your
voting
Medicare.
now?
Yeah.
It's only
Is she
social
voting
security.
to
We don't have to
go
vote.
with it or not?
I'm recommending we table it till next week, till we have a written legal opinion from our attorney's office that says, here's what we're doing. Leanne's not here to basically say what her research was, so I don't feel comfortable making that decision until I know,
Okay.
Because when I read it, it felt like, as an individual, I had that choice to do it, but maybe we don't. Maybe the employer can say no, I don't
Do
know.
we need to withdraw the motion in second then, or
No.
No action taken, table 1 week.
just table it, okay?
Postpone,
Okay, so
table,
we'll
whatever.
postpone this till next week, get a legal opinion, and we'll be good to go.
Okay.
Thank you for coming today, appreciate it.
Thanks for your work on this, Jenna.
Next, we got Becky Bell, Finance Auditor, discussion decision to approve Resolution 84, 2020. Resolution directing advertisement for sale of 4.610 million general obligation capital loan notes, Series 2020A, improving electronic bidding procedures and official statement.
So moved.
Second.
Second. Any discussion on this one? Roll call, please.
Supervisors Groby,
Yes.
Belt,
Aye.
Drake,
Aye.
Wickman,
Aye.
Chairman Schultz.
Aye. Okay. Next, we have Resolution 85, 2020, entitled Resolution Directing Advertising the Sale of $2,045,000 General Obligation Local Option Sales and Service Tax Bonds Series 2020B, and approving electronic bidding procedures and official statement.
So moved.
Motion, is there a second?
I'll second it for discussion.
Wickman, any discussion?
Yeah. This has to do with the Hancock building, correct?
John, the first one.
Get 2 million.
Okay, so we're gonna approve the sale of 2.045 and our low bid was 2.148.
It says dollar amount subject to change in the motion.
Can it go higher?
You can go up to 8 million is what you had the public hearing for.
Good question. How is this worded? It does say, I want to make sure the advertisement online. Subject to principal adjustment, special terms of offering. Yeah, not to exceed 8 million, so yes. So I wonder if we should make that, now that we've opened those bids.
Yeah, but we really shouldn't probably do it until he's verified that, because if these guys get thrown out, then when's the last possibility to change that? Is this it?
Well, the only concern I
I
have
can
with
call
it,
Spear right now and ask Maggie.
if we bond for a project, we can't infuse cash to make it work. You know what I mean? We can't bond for $900,000 and throw in $200,000 cash for a $1.1 million project. So I just don't want us to get in any trouble here. This
Is that true for?
For the roads though.
For local option? I don't know that is.
Janice trying to call in. She was trying to call in while we were talking about the payroll tax.
Okay.
She's not gonna be here?
Well, I try the phone.
Calling in.
Yeah. let me
She's on
put
the
it back
agenda.
on.
Yeah, she's at home.
We've already tabled it.
Oh, she's not coming in.
Yeah,
So,
no, well, she's on.
Becky, is this the,
I'm sorry.
is this the day that we need to approve this?
I can call Spear and ask. This is the day, well, this resolution, yeah, because we have to get this notice to the press, which it does say subject to change. But we can make sure, wonder if we need to, I can make a phone call. Let me get Jana on the phone real quick because she wanted to speak with you.
You are currently the only person in this conference.
Do you know anything about that, John?
In my opinion, as long as we don't exceed the 8 million, you can do about whatever you want, I guess. I don't know
Right.
about mixing the monies, but you advertise publicly that it wouldn't exceed that amount, so you would have to have another public meeting to exceed it. So I think you're good. You could add in the additional dollars, I guess, that would.
I remember partially a discussion Scott and I had at a board meeting a month or so ago when we said, before we put any dollar figures in this bond sale, we should have the bids for the building. And so we now have the bids for the building, but the bond advertisement for sale is not enough to cover the cost of the project. So that's my only concern.
So what do you want to do here?
I'm messaging her right now, but I can call if you'd like me to.
Well, we could have, bonded basically, I think, for pretty much the whole, because the real true cost is what did I say?
Yeah, add 200,000 to that, so it's 2.35.
Oh, man, where did I got that?
Should be able to award the bid next week. It'll probably take a month to get the contract done.
Really, it would have been 2.5, basic, well, that was his estimate, so it's more than that even. It's over the estimate, right? Just a little bit, so it'd been closer to like 2.503,878 if you're throwing in the land and the engineering fees.
Forgot about the engineering.
To do the whole caboodle.
if we were to amend this paperwork now to include, we'd be in, like in Tim's opinion, be better to have more than not, because we can use up to, because you'll have that next project.
Can we just change that to say 2.5 million? That's like Scott says.
I don't know why not, let me call her, but I don't know why we can't. I can get that paperwork adjusted today. Hey Maggie, this is Becky Belton, I'm in the
Because
boardroom.
we published for
I
up
have a
to 8
question.
million.
We
So I think we
we're
can.
doing our process today for that $2,045,000 for the local option sales tax bonds. And we opened some bids this morning and they're a little bit above that. Is there any reason why we cannot change this paperwork today in the meeting to include a higher amount?
And be sure, I mean, go through that executive order, and it's like, could say you could or couldn't. Sorry, but when you're our level, you can't necessarily override executive order. No, but I just. Because what happens is, you know.
Proving will be changed as well. Second question to that, because this is different with the local option sales tax funds, paying this back, does this still stay the same where we would not be able to put cash with the $2,045,000 if for the exceeds? Right, 900,000 and not above, and right.
You can put it on speakerphone.
On $8 million of public hearings. Our thought was, as soon as we get a little further down the road, you would be able to borrow the remaining amount up to the $8 million. We could also, if you did not want to change the if you did not want to change the $2,045,000 amount today, you would also be able to issue debt up to that $8 million number next spring, next summer, whatever that may be. And if need be, we could do a reimbursement resolution right now for the county, meaning that you'd be able to pay yourself back. So even if you used cash but wanted to pay yourself back, you'd be able to pay it back out of that next bond issue.
So Maggie, did you say we could change this today or not?
You can. There's a lot of steps that go involved with changing it. I mean, if we change it today, you're going to have to get a new notice because these are being called bonds. One of the issuances being called bonds, and so you do have to publish a notice in the newspaper. So bond counsel would need to turn around a new notice. We would need to update the official statement because we have to add a new debt service schedule in there. And then that official statement technically was going to go out this afternoon. Obviously, if we update it, it won't go out to the general public for, their marketing needs till tomorrow or the next day, which I think would be okay. So yes, I want to say that you can change it. There are just a couple of other extra things that have to happen if you change it. Becky, can you tell me from a publication standpoint, will that be a problem if you weren't to get a new notice for the bond sale till like later today or tomorrow?
I'll
will you
still
have any
be
problems getting that published?
No, I'll still
In
be
the
sending
paper?
it to the papers as long as I have it there before Thursday.
Okay.
And I'm sorry, Maggie, I just now put you on speakerphone, so they missed the first part of the conversation when I asked about if we did the $2,045,000, if we were able to supplement funds with that, if you could explain
Yeah,
that again.
I'll address that. So if you do the $2,045,000 as it's arranged in the bond proceedings and on the official statement today, you should be able to supplement with cash. It is a little different than your general corporate purposes where you're limited to the $900,000. You cannot supplement with cash because those are reverse referendum hearings. So this local option sales tax is a little bit different. You would be able to supplement if you went over the $2,045,000. The other thing I remind the board is, as another option, you do have an $8 million public hearing out there. So obviously amending it today, you can go up in amount, but the $8 million allows for us to do a second issuance. The thought in our original meetings and our original conversations, I think, with your engineer was that we would be doing that issuance sometime next spring to early summer. So if you don't think you're going to spend all $2,045,000 by that time, we definitely will just go up to the $8 million, and you'd have those proceeds as well to pay maybe for the end of the project. The other idea there is if you wanted to or needed to spend money ahead of that second bond issue, we could have the county pass a reimbursement resolution maybe around budget time or in the spring if you were running out of bond proceeds. And then that would give you complete and full authority to reimburse yourself from the next issuance whenever that gets done in the calendar year 2021.
Is that helpful, gentlemen?
Yeah. Just a matter which way you wanna go.
Yeah, does anyone have any more questions for Maggie?
No.
Maggie, thank you.
You're very welcome. Just go ahead and let us know what your decision is after your board meeting is done so that we can make the necessary adjustments or let bond counsel know. So,
Okay.
thank you.
Thank you.
Have a good one. Bye-bye.
You too.
Thanks. Okay, so
Well, I'd say we just,
change it.
what's that?
You want to change the amount?
I would say we wait and add it on next time we do a deal and get down the road and, because we can pay the difference back.
That's what I'm gonna vote for. To do not change it and put
So
the
move forward
cash.
the $2,045,000 and then we'll change it later.
We're gonna do another issue next, whatever, year, and then,
We can put the cash in.
we can, whatever the difference is, we can get it back out of that next bond.
Gotcha, makes sense.
And just so you know, and John, I didn't get a chance to tell you yet as well, I was working with the administrative part of this and how this will work, and we'll create a capital bond fund for the proceeds. We'll create a debt fund to pay this back, and it will be an official transfer from the local option sales tax roads fund into the debt to pay those payments. So ultimately, if we run into needing to supplement this, you can use your local option sales tax even, and we can pay that fund back, so.
So
I think-
he'll have his own, is that what you're saying?
Because
He'll
if
have
there's
his
any
own funding.
more, you know, whatever you wanna call, it doesn't ever seem like projects, always run true to the course. We'll be able to grab and make everything whole if there's some,
We'll do
something
that
that's-
administratively with the fund, so it'll be really transparent, so.
And
Well,
Maggie
if there's
will,
something that they see once they get in there, they wanna do or need to do, just like they forgot to put water fountains
Maggie
in.
will have to do the.
Forgot to put water fountains in the building next door,
Is that what she
the
said?
B
But we're
wing.
gonna be okay if we don't change it today.
Okay, we don't have to put that in there,
No,
okay.
I think it's smart to ask the question, so, okay, so we've made the amendment as suggested. And, well, she made a motion, oh yeah, we don't have to, sorry, we're good.
We're leaving.
We're gonna move forward with the way it was back.
Yeah, I want it just like it is.
Okay, got the motion, got a second, roll call please.
Okay, Supervisors Drake,
Aye.
Wickman,
Aye.
Groby,
Aye.
Belt,
Aye.
Chairman Schultz.
Aye.
Thank you. Thank you for
Good
letting us
questions.
call and,
Yeah, no worries.
and get the information. Thanks, Becky.
So, next we have, resolution 86, 2020.
John,
declaring an
Did you
official,
think you'd ever get to this point? You're on the way.
declaring an official intent under Treasury Regulation 1.150-2 to issue debt to reimburse county for certain original expenditures paid in connection with specified projects. I
So
need a
that one
motion.
is, if you recall, we had originally had our hearings, then we came back through and we added a couple more public hearings to this that brought us to the 4 million with the court security, the jail ProLogic or PLC, whatever that is called, sorry. And they have started down the road making payments on those projects, so just to be safe and we can pay our funds back.
Oh, so if we decide to bond for, we can reimburse ourselves?
It's in the bonds. We just won't have the proceeds till October, and they've started making the payments. So this way we can pay our funds back.
Okay. All right, need a motion? Is there someone else to make that?
So moved.
Okay,
Second.
Any discussion? Roll call.
Okay, Supervisors Groby,
Yes.
Wickman.
Aye.
Drake,
Aye.
Belt.
Aye.
Chairman Schultz.
Aye. Right on. There's that one. Okay, so now we have, Jana, are you on the phone?
I'm here. Can you hear me?
Yep. We have the decision to process for posting open positions within the county.
Yes. In a previous discussion that we had, this topic came up about does the board want to review postings before we post them? So we're just bringing it to the board for discussion.
Yeah.
Scott, I think maybe you had some thoughts on it.
What did you say?
Can you hear me?
Yeah, what did you say there at the end?
Oh, I said this topic came up in discussion the other day in a policy committee meeting, I think, and Scott had some ideas that he might want to have the board review postings before we post them. So we're just here to discuss it.
Yeah, I think, because I remember we kind of talked about this in one of our board meetings too, but basically, just given everything with COVID and the way our budget's going, we just want, the board want an opportunity to understand if any of the departments are gonna be hiring anyone, before it happens, so we can basically say, hey, yes or no, whether we're gonna allow it to even move forward. A lot of it is just a budget decision, so, so what, I guess, Scott, did you have recommendations on this, or just, is that kind of
Well,
general how you see it?
I just think it's our awareness of that, and at least have that discussion. And, we're gonna be going into budgets too. So that, the worst thing I think we could do, is hire someone and then 6 months later say, sorry, things aren't,
Right.
what we thought they were gonna be, and,
I'm gonna ask Matt, do we have the authority, so let's say hypothetically, you wanted to backfill an empty vacancy you had in your, do you have to get our approval to do that?
I don't
As long as
think
we've approved your budget?
As long as I have the money in the budget, it's sort of
That's
my,
kind of how I advise.
that doesn't mean you don't have the authority to do that, obviously, for departments that work for you, as
Right.
opposed to, independent elected officials.
So
So whatever's,
altered as if we took your budget away.
absolutely, but then the problem becomes mine, right? If you just tell me, well, you've got 100,000 less, then I gotta make a decision about who to can in the office,
Gotcha.
at that point. I'm not opposed, honestly, I don't really know that it's a big issue, I'll just say from a department head perspective, it's a long process to get somebody on board. When somebody tells me they're leaving and they give me their 2 weeks' notice, I have to post a position for at least 2 weeks. Then, once I post it, then, we go through the interview process, and then they've gotta give at least 2 weeks, once we make that decision, they've gotta make at least 2 weeks' notice. And so I always feel like I'm 6 weeks behind, the 8 ball. As soon as somebody says, hey, I'm moving on to something else, I know I'm gonna have a problem for 6 weeks, at least until I get somebody in. And so going through the process of getting board approval to post position, and that won't just be me, that would also be the engineer, that would also be IT, whoever is gonna have the same issues. So that you're just adding another layer that keeps those positions vacant for another week or two until the board has a chance to act on it. That's just devil's advocate. I generally don't have a problem. I usually know when people are, I've got some time, but that doesn't mean that happens all the time. I got two I had when Luann passed away, her legal assistant position came open. I've been holding a victim witness position open for months, which I just recently promoted from within. But that forced me, of course, then to post for, clerk position, which 180 applications later, we're going through the interview process, as we speak. But I still, it's gonna be a while before I get people on board. So that's the only reason I'd say to be cautious about that, is that you don't want to slow that process down too much. On the other hand, I totally understand not wanting to let willy-nilly hiring take place that you don't have, some input into.
Maybe would it be beneficial just to designate someone on the board to say yes or no on that? Because in that way you don't have to wait for board action. I mean, then we can just say, well, this person has that authority to make that call.
Well, or just have Elizabeth or Jana, Jana let us, or Jana, let us aware of that. And if it's an open position, it's one thing. If it's a new position, it's another thing.
Well, right, that's what's been, I think that's where a lot of the problems is coming, is the new ones that pop up that we didn't even realize is now, I'm not gonna call it our problem, but now it's something, it's a budgeting factor that now we gotta take into consideration.
Well,
This employee we didn't know was gonna be there, now they're there, and now all of a sudden we gotta.
Probably no matter what it is, it's almost, an 80 grand deal into perpetuity.
Right.
Anytime there's a new position, it does come to the board first.
But it comes through our consent agenda.
Okay.
When all of our department heads came to us during the budget studies, we budgeted and pay for all of the existing employees that we have. I'm not comfortable saying to a department that loses a person through attrition or another job, saying you have to come back to the board to get approval to rehire that person to fulfill the duties of your office. Now, if the board wants to consider saying no new employees, I'm okay with that. I really don't want us to saddle our department heads with another layer of that. I mean, it's in their budget. If we want to.
It's in their budget, but you also have to look at it from the other reverse side of this. So let's just say hypothetically we don't get all these CARES funds, we don't get all these things backfilled. Now all of a sudden we're in a situation where we're having to pull from our cash reserves, and now we might have positions that we may not have wanted to fill right now. Maybe the offices can get by without that person for a little while until we can get our finances back in order. I think this is just telling us, hey, let's check it real quick, make sure you're good. I think that was the whole intent of this discussion. It wasn't necessarily to say that every department has to go through us. It's just more, hey, hold on a minute, this person's retiring, or this person's quitting, or whatever. Are we gonna be okay next year to backfill this or not?
Well, the other side of it is, it's a
Put a hiring
budget.
freeze on.
It's a budget, so, okay, so the department, we approve their budget. So we get to the end, and they're, whatever, 200,000 over their budget. Then,
We have to deal with it.
we gotta deal with it. But if we're gonna take them off, the new positions off the consent agenda so that we all can at least have a discussion about it until we see how this thing all shakes out. I'm fine with that too. I just think we need to really get kind of focused on what this next year's gonna look like here real soon, so.
Yeah, I don't disagree with that at all. I see where you're going, and I'm like that too. It's like, hey, department head, we hired you to be the department head and to do this job, manage it,
But they can't control everything,
No, but you're right.
I just think, that it's probably the most valuable assets we have are our people. And it's probably I'm gonna guess, I think I'm pretty close. It's the highest expense we got. as an organization.
We also have great department heads too.
No, I didn't say.
I was just gonna say the very same thing.
That's not the point.
Yeah.
I didn't say
That's
that.
irrelevant in
Yeah,
this
no.
conversation. I mean, honestly,
I
because
think
it's,
that all the way through from the top down, we got great people.
if you got X dollars to function as payroll, and now all of a sudden we're not gonna have X dollars at the end of the year, that's what this is allowing us to do, is make a quick review and say, hey, hold on, don't hire that. Or hey, maybe not hire, part of this too, Scott, was that some of these folks are just getting hired on right at the same pay rate that the person that left was, and that might not necessarily be wise either. And that's happened a lot. You know, I think it just gives us that chance to be like, well, you need to put them and hire someone at the front end of that pay grade.
I just know that there's some smaller counties than us in our state, and probably in some other states too, that have, you know, made some, you know, employment decisions that probably weren't real favorable with some people. But I don't wanna, hopefully we don't have to do that.
I'd rather not get in a situation where we have to let people go. I'd rather just not have hired in the first place.
Right, yeah. That's all, that's really all I, you know. And maybe we just, maybe when we get all the department heads and elected officials, just kind of talk through the thing and make sure they're all, and maybe they all are on top of it, I don't, you know.
Okay.
I don't wanna micromanage their budgets and stuff, so we gotta do that once a year.
So I guess, Jana, the direction, I guess, is gonna be, we're not gonna take any action on it. We're gonna give you the direction to, take this back to department heads and discuss a little bit more. And
Okay.
see what they think. I mean,
Okay.
I think the underlying thing here is that we need to be very budget conscious about what's going on right now. You know, I've mentioned before that revenues coming in, expenditures going out are not meeting anymore. And so it's either our options are raise taxes, take from fund balance, or we start drawing some stuff back. So we need to be conscious of that, so we're not, you know, if you hire someone to do a data entry job, maybe we hire that person to do the data entry job at the beginning of that scale, not necessarily the top end of that scale. Because by the time you do it with 5 people, you know, we actually see some real savings there. But okay, moving on.
Sounds good, thank you.
No action.
Thank you, no action taken on that one.
Okay.
We're moving on to, we're gonna take a quick 5-minute break here. Let's do 10-minute break, so we can kind of get a handle on what's going on, and then I would like to, when we come back, we'll make the motion to go into closed session. So, let's take a 5-minute recess.
What was our guesstimate on money for the, was it 3 shops?
I'm telling you, that phone came in. Oh, we're recording, never mind.
They're not worth $8.
Oh, the resales,
Yeah.
I'm about to
I'll
stop.
dig that out for you,